Hi, I'm Jack Berkowitz. I'm the Chief Data Officer of Securiti AI. We're a company that works in data security, data privacy, and now all about AI and generative AI governance and security. With me today is Vignesh Shetty, who's one of the Senior Vice Presidents at GE HealthCare, involved with data. Welcome to the interview, Vignesh.
Thanks, Zach. Thanks for having me.
How do you see the Gen AI impacting your teams over time, impacting your systems? But then also, as a second question to that, how are you going to bring sort of that governance and those philosophies forward on something that's a little bit, different in terms of controlling and in terms of measuring?
So, before I get to the Gen AI part, I do want to emphasize that even traditional AI, I think there's some juice left there in that lemon because earlier I think in response to your earlier question, I said there's data as insights in some ways. I view data as insights that are hidden behind a veil, waiting to be unlocked. What I really meant is even today we are seeing even machine learning and deep learning still attaining escape velocity, at least in healthcare, and trying to build maturity to address clinical and operational healthcare challenges. Because that there is the opportunity to turn the tide on a healthcare cost, and not everything necessarily requires Gen AI. You could sort of go to build
Exactly. I mean, these
yeah,
are complementary tools. It's not like, well, retire that, right?
exactly,
It's
exactly,
complementary tools. There's still a world for ontologies. There's still a world for first order logic, particularly in healthcare, right?
absolutely,
And all of these things interact to come together to build more and more intelligent systems over
correct,
time, right?
correct. And because as case in point, I think there was a recent study, I forget by whom, that claims that we can reduce healthcare costs by about 200 to 360 billion with existing technology, even pre-Gen AI. I mean, to put that in perspective, that's the GDP of some very, very large countries. Some
Yeah.
serious efficiencies there. As for generative AI, coming back to your question, I think there's a potential from an addressable market standpoint for just in healthcare to create another 150 to 260 billion in value, largely through productivity improvement and on focusing on refining the signal from the noise. Because part of the challenge with healthcare, I talked about the volume. It's got 30% of the world's data and growing at 36% per year. So how do you sift the signal from the noise? So I think where Gen AI would play a step function improvement role over the traditional models is A, helping us sift through that signal to noise, and dramatically improve productivity by making the user interface a lot more conducive to the average user. Than you don't need to necessarily be a data scientist or even an app developer to consume the benefits of it. That's what ChatGPT really did. Is it sort of created this notion of a universal explainer, right? That allows anybody, right, from my grandmother to my son, to be able to access it and ask it or probe it and prompt it in ways that are conducive to their command of the language and what they really want to know. So that I think is the big step function improvement in productivity. And and to your question of how are we approaching it differently, I would say there's some elements that are common and there's some which are different. The parts that are somewhat different than our traditional ML approaches is we are actively looking at generation of synthetic data to complement RWD or real world data to drive actual bake-offs to identify the most robust foundational model or large language model in terms of both efficiency, accuracy, but also potential risks of being subject to hallucination. So that's one thing that we're doing, is trying to determine the extent of model drift, bias, and proclivity to hallucinate or lack of it thereof. So we're trying to look at that differently than we would do with traditional AI. We're also looking at Gen AI and trying to use that to democratize ability to build, to deploy, and consume our offerings at scale, which we couldn't do simply because building an application on traditional AI required a certain level of expertise, which wasn't omnipresent. Now you can create more easy to access and easy to consume interfaces, both for developers of applications as well as consumers, that I think truly opens up the possibilities in terms of what we can do. So that's kind of how we are looking at it. The last thing I would add is what Gen AI has opened up is early stage possibilities. We still haven't gotten tangible proof points yet of application that can leverage multimodal AI. So it's not just images, not just text from, let's say, a patient record, but a combination of images, text, maybe genetic sequences. How do you sort of combine them together to push the envelope and start closing gaps in healthcare? So that's kind of how we're
Yeah,
looking at it.
that idea of bringing together the context, which, we've all been patients, we've all had relatives that are patients. We may not be involved in the medical field directly, but that idea of getting the context together, and that,
Yes,
and you hit it right. That fusion of information
correct.
is really the thing today that I think we're going to see a lot of capabilities moving forward in the future. So why don't we, ask you give you the last thing, which is, where do you see our profession, right? CDAOs, the teams of data professionals being. I'll let you pick your time frame. A year, 5 years. Where do you see things going next?
So specifically first in the context
For
of
our profession, for what we do
our
for a living.
profession,
Yeah.
yeah, I, I actually view the role of the CDO becoming even more strategic um, when it comes to decisions around how you allocate capital within. So I'll break it down into two parts, right? What our customers' expectations would be of, regardless of your industry, of what the CDO's role is, and then what the CEO and others would expect of the CDO. So internally, I see us becoming even more integral part of the strategy and the future of how we define how work gets done in the company. This means capital allocation. It even means M&A. In our case, in GE Healthcare's case, it means helping the company make more informed decisions on how we can actually realize our vision to be able to create a world where healthcare has no limits. And that specifically means, can I use data to create both individualized or personalized care, as well as something that's affordable to patients? So the role of the CDO is becoming increasingly more important because the currency of being able to offer that value is data. And guess who's the person who the executive, the C-suite is going to help make informed decisions? It's the CDO, right? I would argue that the healthcare system, even the hospitals, will benefit by having similar roles within their staff, because it helps them drive both increased efficiency, but also improved accuracy and ultimately better patient outcome, because you're now making data-driven decisions. You're building AI capabilities to help sort of sift the signal from the noise. It's an exciting future. I'm very proud to be part of it. I'm sure
Yeah,
so are
so
you.
am I. Fantastic. Well, look, thank you very much. I've been with Vignesh Shetty, who's Senior Vice President at GE HealthCare. My name's Jack Berkowitz. I'm the Chief Data Officer at Securiti AI. Really enjoyed our conversation and look forward to meeting up and chatting again soon. Thank you.
Likewise. It was a pleasure. And thanks for having me again, Jack.